Hello, everybody. On today's Two on Your Side Town Hall, an unprecedented surge. COVID cases spiking in Western New York in a way that we've never seen before. We're going to have an expert here live to give us some perspective and advice on how to deal with it. Plus, a viral claim that almost a third of coronavirus patients are dealing with symptoms many months later. The Verify team looks at this claim about long COVID. And arrested again. Just how many people who are set free because of bail reform end up back behind bars on serious charges? We'll have a live discussion on that in just a bit. And we're glad you're here with us. We're going to we started this town hall format at 5:30 at the beginning of the pandemic. And now that we're dealing with another COVID-19 surge, it is very top of mind for a lot of families watching right now. Our goal from the beginning has been to help inform you of what's happening and give you an opportunity to get your questions answered directly from trusted experts. And so that's what we're going to do once again on today's show. We want to start, though, with this. It really helps illustrate where we are right now. This is a look at the 7-day total of new cases per 100,000 people in Erie County. And this goes all the way back to March of 2020 on the left side of your screen. You can see we've had several spikes along the way. But take a look at the far right. We have never been anywhere close to where we are right now, almost triple some of our previous peaks in terms of new cases. Clearly, Omicron is spreading rapidly here, and this is the case all over the country and in our other counties as well. Thankfully, we are not seeing, though, the same type of increase in hospitalizations and deaths. Let's discuss that and more right now with Dr. Nancy Nielsen. She is Senior Associate Dean for Health Policy at UB's Medical School, and it's always great to get your expertise. The number of cases is obviously worrisome right now, but I mentioned that silver lining in terms of hospitalizations and deaths, although they sometimes lag. So let's just start here, big picture. How bad is it right now in your estimation?
It's really, really bad in terms of the number of cases. It's almost a vertical rise, as you can see. This past week, Erie County had 13.5 thousand positives. So overwhelming, the Department of Health for the county, they can't even do contact tracing anymore. Luckily, most of these cases, at least in people who are vaccinated, and particularly those who are boosted, are mild. But I will tell you, Michael, we have had an increase in hospitalizations in the last few days, and that is a change from last week.
Yeah, I want to pick up on that because all along we've heard that the biggest concern is hospital capacity. And that's why even fully vaccinated people who, as you mentioned, are pretty protected, have still been encouraged to follow these safety protocols because, in a sense, we're all in this together. We need a health system that's not overwhelmed. So what are you hearing from your colleagues in the medical field right now who are working in our hospitals? How do they look in terms of Omicron, reportedly not as severe as previous variants? I know we were seeing a little bit of a downtick at hospitalizations, but that's now reversed.
That's right. And there are two things that are affecting the hospitals. The number of people coming in, and even though this is milder, if you triple, quadruple, or more the number of cases, you're still going to get more hospitalizations. And as you pointed out earlier, there is a lag. So we haven't seen the peak of this yet. The other thing that hospitals are dealing with is their staff who are testing positive. Doctors, nurses, environmental workers, dietary workers. It's a problem. It's not just a problem for the airlines, which we know caused some chaos over the holiday weekend.
Yeah, every single industry dealing right now with so many workers testing positive and then having, if they're symptomatic, to stay home for 10 days or in some cases even longer. Many of the questions, Dr. Nielsen, that we get from viewers right now are about testing. We've talked about this ad nauseum, but things do kind of keep changing and testing is as important now as it's ever been. Some people have used the at-home rapid antigen tests. They do it at home, it comes back negative, but then they still have some symptoms. And so eventually they'll go get a PCR and then it comes back positive. And so they're wondering how much confidence should we have in these at-home tests right now? And for somebody who's watching us who wants to get tested for whatever reason, what is your advice on where they should go, considering many places are full, they have waiting lists, or the tests cost a lot of money?
Well, you make a bunch of points there, but before we talk about the testing, I want to address one thing, and that is CDC has now recommended that the isolation and quarantine time, if you're testing positive or if you've been exposed to somebody, be cut from 10 days to 5 days, and they probably will make an addition to that within a day or two by requesting that you get an antigen test. But let's get to the testing because that's really important. We've talked about this before, but it bears repeating. The PCR is the best, most sensitive, most specific test. That means it's really not going to miss very many infections at all. And the reason is that the PCR test picks up any small bits of virus genetic material in the sample. The difference in the rapid antigen tests is in order for them to be positive, the virus has to be replicating pretty rapidly. So it's a difference between picking up a bit of genetic material or picking up byproducts of replication. And that's why the rapid antigen tests do miss some. Now, they're not bad if you're symptomatic. If you're symptomatic and you get a positive rapid antigen test, you can pretty much be guaranteed that you have COVID. If, on the other hand, you are asymptomatic, and let's say you were a contact of someone and you get a negative, a single negative rapid antigen test is not good enough. You really need to do them serially, usually a day or two later. That's really important. Once you develop symptoms, the rapid antigen test probably will be positive. If you have symptoms and you got a negative rapid antigen test, go get a PCR.
Great explanation, because I know a lot of people are kind of trying to navigate all of that. I also want to ask you a little bit of news that came out just today. The FDA now recommending that kids 12 to 15 get a booster dose, as well as kids who are immunocompromised in that age 5 to 11 group. There is some pushback on this. It's not final yet because the CDC still has to weigh in, but there has been this dramatic increase in kids getting hospitalized with COVID. But what we're hearing in terms of all the reports is that they're almost all unvaccinated. And we've heard so much about how the vaccines are so protective for children. So do you think boosters are really needed at this point, or do they have a pretty good level of protection just from the 2 doses of the Pfizer vaccine?
Well, I think any kid over 5 who hasn't been vaccinated, I would ask the parents, what are you thinking? I mean, seriously. If the kid has been vaccinated with the second dose, because they can only get Pfizer, so you get dose 1 and then 3 weeks later you get dose 2. If it has been a few months since then, that child ought to be considered for a booster. But I think the real problem is that kids who are 5 up to 19, the number of kids who've been vaccinated is really appallingly low. And I really would say to parents, please rethink that, get your kid vaccinated as soon as possible. We are seeing a number of kids being admitted all over the country with COVID. This is not a trivial disease. They usually do okay. Most of them get admitted for dehydration or breathing difficulties and they recover. But we've had some long-term symptoms in kids. This is not a trivial disease.
Finally, Dr. Nielsen, I want to ask you about a theory regarding the evolution of the virus. I've been told by you and our other medical experts that a virus essentially wants to survive, right? So if it becomes too deadly, it kills the host before it can spread to somebody else. So oftentimes these viruses tend to get weaker because they want to survive. Is that what is happening now with this new Omicron variant? And people are wondering if this maybe could be the beginning of the end, because if the virus gets weaker and it becomes something like the common cold, that we at some point in the future can kind of start to live with this and get closer to normal. Are we close to that point, you think?
Well, I surely do hope so, Michael. You're right. A virus that infects a host and kills it before it jumps to another host is not very efficient, right? It's not going to survive. So evolution does tend to keep these creatures alive for quite a while. So we do believe, based on what we've seen in South Africa and in the UK, that the virus is milder. Hospitalizations are about half of what they would be if you had one of the earlier variants. But it's still not a trivial disease, and your immunity does wane over a period of about 5 months. And the FDA, by the way, has just recommended that the time for boosters be lowered from 6 months since your last Pfizer vaccine to 5 months, acknowledging that it's basically that period of time when your risk of hospitalization, which used to be lowered by 2/3, goes down to about half. So that's why boosting is important, but nothing should keep people from getting the primary vaccination. And do not think that just because this may be a milder disease, you can just ride it out and all will be well. We hope that all will be well when it has run its course, as it seemed to do in South Africa. So I would say, yes, I hope that is the case, from your lips to God's ears, as they say. And let's hope in the new year that's exactly what happens. Meanwhile, get vaccinated, get boosted, wear masks, and take care of yourselves.
See where we are. It's definitely going to be a tough couple of weeks. Dr. Nancy Nielsen is Senior Associate Dean for Health Policy at the University at Buffalo's Jacobs School of Medicine. Great to have you on. Thanks for covering a lot of topics with us.
Thank you, Michael.